Beautiful people, it is Freedom Square News, and we are with Ichie Dr. Bun Eze, Chief Medical Director, St. Sylvester Multispecialist Urology Hospital, and Chief Consultant Urologist and Head of Urology Division, Parklane, Enugu, Nigeria.
There is also the domain of psychological erectile dysfunction. In that case, physically, the man doesn't have any physical problem. But because sex is a complex thing, being organized at the level of the limbic system, part of the brain that has to do with emotion and the rest of them. If a man is not happy, if there's anything disturbing him emotionally, if he doesn't like the person that is trying to do something with him, if he's in an inappropriate environment, the environment he's trying to have something happen is not appropriate. He's afraid they might catch us. I'm a brother, and the church people will catch me, or things like that. That could be a situation where the man's psyche is what is causing the erectile dysfunction. That might actually be the easiest type to treat, because you just sort out the psychological issue by either cognitive behavioral therapy, that's counseling, helping the man identify his problem and counseling him. Once had a man, his problem was that he married initially, felt his wife was so beautiful, he was sharing with a lot of people. So when they separated, he looked for the one that wasn't as beautiful as, and he has a flair for beautiful ladies. So when he wasn't working, everybody understand, see, guy, your problem is that you marry someone you don't have feelings for. And what we should understand is that liking someone, everybody has their own sexual fantasy, has nothing to do with just the physical appearance. Even physically, men have what they like in the body of women. Let me not start mentioning names. So if you don't identify that thing that attracts you in a lady, you might start having problem. Don't laugh, I'm saying the truth. You need to identify what makes you do. And then if you see a good girl who you don't have any sexual feeling for, marrying her will be the wrong thing, because you'll be struggling all your life too. So what I just told you when I make him realize that you marry someone you don't like, there are only two solutions. I'm not giving you drugs. Either you learn how to love her, which is possible, or you part with her and get somebody you are physically attracted to. Your sexual life will come back. Okay. So it took me time, like up to 4-hour session, to calm down where the problem is. So it's not a question of even listening to what the person says, even non-verbal cues the patient releases can help us identify this. So you see, it's not an easy thing. Then the third domain is when the one we call mixed erectile dysfunction. Mixed means the person have an identifiable physical problem and there is a psychological component to it. That's the commonest form of sexual dysfunction, because people that can't get it right, even the performance anxiety, when they're in a situation, can I perform? Is it possible? Is it not possible? This is not my field. My career is over. That will make the person, whatever the drug you give the person, to not perform. So there is the organic or physical type of erectile dysfunction that has identifiable medical cause. There is the psychological aspect of it, and there is the mixed type. That is a combination of both the physical and the psychology, which is the commonest type. Because you go the first time, you don't perform. You go the second time, you don't perform. The third time, you are even convinced yourself, guy, I'm not sure whether it's going to work today. And that is why when we treat all forms of erectile dysfunction, counseling, or what we call cognitive behavioral therapy, will be an important part. Maybe say a man has hypertension causing his erectile dysfunction. You also need to work on his psyche, because the longer the hypertension have killed his erection, the more his worldview have changed, that my career is over. So you need to, first of all, make him understand that he still stands a chance before you can now start putting in medications and expect results.
Wow. So without being religious, faith plays a big role in many things.
Everything we do in life If you believe you can or you believe you cannot, in those situations, you are right. Like if you come out and say, I can't handle this, sincerely, you can't handle it.
Wow.
If you come out and say, I think I can handle it with pure conviction, yes, you can handle it. How you handle it, you might not know, but you will certainly handle it.
Doc, you are godly. All right, beautiful people. Remember, as we have fun, as we get educated and informed, not to be deformed, we are on Freedom Square News. And your comments, your contributions are very, very important.
So if we are able to determine that a man has erectile dysfunction, really, the next thing will be to determine the cause. And determining the cause is the major work of whoever is evaluating a man with erectile dysfunction. As I told you, it might take more than one hospital or two hospital visits to be able to determine the cause. And but until you determine the exact cause, you won't get a result, or you won't get a sustainable result. So what do you do? This man has erectile dysfunction. We've proved that. You take, I've said it before, you take a comprehensive sexual history. It's not just I have erectile dysfunction, we now start. So the comprehensive sexual history will tell you everything about what challenges he's having with achieving an erection. Then some persons, what you really need to know is that nobody gets it right 100% of the time, not even you.
Yeah.
Like it's not all the time you want to do that. You think we just stand up. There are some levels of failure.
Of course.
It's not all the time. It's not all the time that the man gets it right all the time. The health of fact, even physical exhaustion. You've gone to work after I finish drilling you today. You might try to do something. Your body is tired. What you need is rest, not sex. So because of that, just having some few occasions of not being able to achieve erection or not being able to sustain it for satisfactory sexual intercourse might not qualify for erectile dysfunction requiring treatment. So these are what the history will tell us. Then when we finish doing the history, even in the history, we will also include some underlying medical conditions. Are you hypertensive? Are you diabetic? It can be as simple as this man is hypertensive. He's taking a drug which is killing his erection. Treatment will now become identified is the drug. Remove the drug, switch it to another drug that is erectile friendly. The man has his salvation. You understand what I'm trying to say? Then after that, those history will come physical examination. You need to look at the man from the crown of his head to the sole of his feet. Examine him thoroughly. When you are now done with the examination, you now have an array of information which we sit down and then decide, one, does this man need to do any test or investigation, and which investigation does he need to do? The tests that can be done are myriad. We can't finish mentioning all of them. So it's the work of the doctor to say, having taken your history, having examined you, you need laboratory investigation. That test can be as simple as taking a blood sugar. You think the man is hypertensive, is diabetes that is killing his erection. You take his random blood sugar or fasting blood sugar, the case might be, treat it, and the sugar is within normal, and his erection start coming back gradually, even without doing anything. It could be as worse as even getting a brain scan. So the investigation you are going to do is not like what you can say and start saying you will do this, you do. There is no particular battery of investigation that must be done. Investigation is individualized and is being guided from what you got from your history and from your examination, just like everything in life. So when you have erectile dysfunction, the right thing to do is not to go to the lab, do testosterone, do this, do that. If I will ask somebody to do testosterone, I will have examined the person and seen obvious features of hypogonadism. By that I mean obvious features of maybe the depression in hormonal level in the man. There are things I will see in the man. I say, okay, this man is a candidate for hypogonadism. Let me now go to this, check the testosterone, check the check this. So just this issue of check. The right thing should be putting things in their proper order. Your history is taken to identify what you think is your problem. you are examined. Then other tests that we follow will now be to help straighten out things. You cannot finish all the tests in the world just because your manhood is not giving you what you want. As I said, if on history, you can even identify what the problem is and fix it there. No need to even go and check any other thing. That's what I'm trying to say.
Okay.
Then if it is psychological, the things of the mind, you don't need to take blood tests to check it. Maybe there are some psychological tools they can be mentioned. Maybe you are depressed. After if a man is not happy about his depression alone, we make him this thing will not stand. So we should be able to administer some psychological tests, not physical tests, that we able to identify, okay, this is level of depression, this is what he's having, this is what he's having. So even drugs, as I said, somebody that has like a bipolar affective disorder, taking some psychoactive drugs could cause erectile dysfunction. In that case, we balance, make him understand that this drug you are taking to help you function better physically might be what is causing you this problem you are having with erection. It's already giving the man some level of cure. You don't need a test to prove that. Once you understand that this is his problem, okay, we can now continue this medication and then add this to be able to counterbalance the negative effect of those medications which you need for proper social functioning on your sexual life.
Right. All right, beautiful people. Don't forget it is on Freedom Square News. And with Ichie, Dr. Bun Eze, Chief Medical Director, St. Sylvester Multispecialist Urology Hospital, and Chief Consultant Urologist and Head of Urology Division, Parklane, Enugu, Nigeria. Don't forget that you sharing this post is very, very important. You may just be saving a life. That is the purpose and other purpose which me and you know. All right, Doc, finally, just let me not abuse my time with you.
Finally.
Finally. With you, we can't get tired of
because in Nigeria, there is nothing like finally. You could either be finally, or finally. Let's say finally.
It's all right with you. If I thought Oliver Twist, I may not be blamed.
Okay.
All right. Just few things that a woman does to also cause or to activate erectile functioning or dysfunctioning. Can a woman contribute to this issue? Like what she does in the act of sex, My father said, no, okay,
okay. The thing is that, when a man has sexual dysfunction, or let's say erectile dysfunction, I would prefer a couple session.
Okay.
A couple session is where both couples sit down and both parties are hearing firsthand discussions that is being held. That's what I'm trying to say. They are hearing those discussions because most of the time, pressure, any form of pressure from a woman, could cause ED for the man. Let me start from there. Can be pressure of bring money. It can be pressure of let the thing stand now. The thing is that power flows in a relaxed environment. If a man has erectile dysfunction, the understanding of his partner, it will be key to helping him overcome it. If the listening is silent, it's not working today again, it will never work. You get what I'm trying to say? Then the other aspect of it has also to do with, I can't forget an encounter I had while in training. A very respected citizen met me complaining his manhood is not working well. And I said, bring your wife. And when I saw his wife, I was able to agree that even though she's supposed to be a pretty lady, she's not taking care of herself. What I'm trying to say, she's just the reverend's wife. The way her grooming and everything is not what will make even the reverend himself see her and start having an erection. There is some element of fantasy in sex. There is some form of anticipation. You know what I'm trying to say? So just like a well-prepared meal, that's how they will package it. Everybody will have interest. The one is just a woman allows herself to just be anyhow because you are married. You won't even brush your teeth. You won't groom yourself. You won't do anything. For goodness sake, the man will be an angel to start having an erection. Not even a priest can have an erection, like an Anglican people that marry, having erection for a lady who is unkept. For such, I just told the woman, not the man now, you are the cause of your husband's problem. Go and take better care of yourself. There is something I did to make that diagnosis, not a lab. I just told my house officer, take that this reverend inside this room examine. When she ran back, I told her, I know what the problem is. That when I called the man and say, you see now, you don't have a problem. I just allowed a clean young doctor examine you. Your team is already standing in a public place, so just like there is an enclosure. That the same way, if your wife is able to, I told the wife, if you're able to clean up yourself, your husband don't need any medication. I didn't give any medication. That alone helped.
All right, beautiful people, continue to pray for our doctor. I'm being honest with you. Oh, the things at his hand. Continue to pray for him to be healthy, to live long, to continue blessing our lives. All right, beautiful people, this is where we end it today. Remember, continue following as we bring the next episode to you anytime, any day that He gives us the opportunity again. May God bless you and remain healthy. Thank you. Your last word to our viewers.
Well, thank you for your attention. I think we'll just be trying our best because it's a duty we owe society, just like a social responsibility. Because the people in the Bible say many people that perish don't perish because they are damned, but because they don't have the necessary information. And information is something that we could easily share with people and improve their lot, so that they will remain healthy. Because health, all form of health, not just physical health, like we're talking about now, emotional health is also important. So please, when you go out there, just be happy and remain blessed.
Bye for now. God bless you.